Cloud and digital transformation journeys continue to define and shape the strategic growth agenda for organizations. Executives at these organizations are leaning on data, analytics, and AI to drive competitive advantage. With a combination of artificial and human intelligence, executives at these organizations are making more informed decisions to enter new markets, launch new products, and to create compelling and personalized experiences for their customers, partners, and employees. I am excited to have two of our leaders, Divya and Kevin, join me today to share their perspectives on the trends that are shaping the future of healthcare and retail industries. Let's start with healthcare and Divya. Future of health is top of mind for our healthcare clients, and that has been at the core of driving the strategic journey for our clients. Can you talk a bit about the trends that you're seeing in the healthcare industry and how some of the use cases have been coming to life given cloud, digital transformation, as well as analytics?
Certainly. I think I will have to start by saying, probably the biggest understatement, being that affordable healthcare is still a huge challenge. Right? We have over 25 million people, probably closer to 30 million people now, that continue to be uninsured. Number one reason for bankruptcies in the US is not being able to pay healthcare bills. So even though there is a lot of progress that's happened in healthcare, there is just so much more work to be done. So as you mentioned, what are some of the big trends around the future of health? I kind of think about it in the fundamentals. I sort of look at it from four main buckets. First is around redefining primary care. So really thinking from a root cause perspective. If you're able to do primary care really well, meet members where they are, whether that's from a time, cost, location perspective, focus there. That's where you're going to have a lot of impact. Second is innovation and recalibration, how we care for patients in inpatient and outpatient settings. So leveraging AI diagnostic tools, predictive analytics, better remote patient monitoring, care delivery outside of the four walls, bringing home and health back to your home. And third is around redefining financing of healthcare. So thinking about whether you believe health plans should exist or not, if you have really well-developed value-based care and being able to know what those outcomes are and pay for those good outcomes, not just procedures, that's another huge bucket. And lastly, it's around administrative services across healthcare, around utilization management, revenue cycle management, better retention of healthcare providers. So those are sort of the four main buckets we see a lot of where future of health is going to go.
Interoperable data and platforms is starting to become the crux of the transformation journey in healthcare. And that is also laying the foundation for the future of health in terms of enabling AI use cases that can drive significant value in terms of areas that you talked about, whether it is patient care, primary care, as well as looking at disruptive financing. Can you talk a bit about what specific use cases come to mind in terms of what you're seeing in the market?
Absolutely. So I think the first thing I always talk through is a spectrum. So you have several large health plan, large provider organizations who want to build a lot of capabilities in-house because they believe that once these capabilities are built in, they don't have to pay an additional fee to someone else. So that's sort of the one end of the spectrum. The other spectrum are probably smaller, mid-sized regional players who don't want to build these capabilities from scratch, but want to quickly leverage existing technologies to get the benefits from cloud, AI, automation, IoT, 5G, etc. So depending where they're on the spectrum, the set of use cases can be a little different. But regardless, I think everyone knows from a very basic kind of capability perspective, you have to be able to be cloud enabled. So often what we call is taking a client on a cloud journey. So let's take a real example. We've been working with a large academic medical center. They have an ambitious vision around transforming the care for complex diseases. The last 2.5 years, they've been migrating a lot of data via the Google Cloud platform, and they've basically built infrastructure to now allow, from an AI automation perspective, have clinicians really come into what they call an AI factory area, have all their data available, and then be able to build the models that they need, and not just build them, but also be able to quickly deploy them. That might seem like what a lot of healthcare providers are doing, But really, the key factor there is scale. Can you deploy 2, 5 models or 50 AI models and really be able to see the benefits of that? That's just one example of a very mature kind of provider organization. But I have to call out solutions like GCP's Vertex AI are really powerful for workbenches and tools that really help both rapidly scale and accelerate the capabilities for healthcare organizations. Can go across a whole bunch of different use cases, right? Everything from patient monitoring to better ways of doing for providers, their research trials, being able to better manage their revenue cycle management to health plans, where here we're trying to improve enrollment experiences, improve the kind of benefits that members are getting, and then being able to think more from a value-based billing. So there are a whole bunch of use cases, which is I kind of call the what bucket. The what is unlimited, but the how you get there first is absolutely having a scalable cloud platform on which you can build all these kind of use cases on. I think the last thing I probably end us by saying, I hope in 10 years or so, when I'm having similar conversations like this, I won't be starting a conversation saying, affordable healthcare is still a huge challenge. Hopefully that statement will no longer be true.
There are a lot of parallels in creating patient experiences as well as creating customer or consumer experiences. And as you look at the retail industry, that has been of a lot of importance and surfaced to the top in terms of how best today's world of cloud can enable richer experiences for customers, and frankly, how they delight customers. Kevin, do you want to share some perspectives on retail and how we are seeing some of these trends shaping up?
Absolutely. So historically, the customer and the customer experience has been the number one focus for many of our retailers, and equally starting to gain traction is around the associate experience. And this is compounded by both labor availability recently, as well as labor cost, and just the changing nature of the customer experience. Whereas a lot of our physical retail clients have been able to operate just within the four walls of their stores, now with whether it's curbside or delivery methods, just the pressures put on retailers has really compounded and accelerated over the last 2 or 3 years. So we're seeing a lot of our clients investing in the associate experience, and whether that's task management or next best action solutions, so that they get the most productive labor out of the very scarce time that they have with their associates in the store, to both drive operational excellence, but then also meet and exceed that customer expectation.
So one of the areas for transformation has been the Google Cloud Retail Common Services platform. You've been helping shape that journey for many of our clients in the retail industry. Can you talk a bit about not just the platform, but in terms of data, analytics, AI, how all of those building blocks come together in driving, as you pointed out, not just the customer experience, but also the experience of the associates that are working within these retail organizations?
Google platform has been transformative in one of the big client programs that we're driving right now. So specifically, we're working with a national grocer to really see how they can unlock and accelerate the associate and the productivity of their teams. So specifically, we've been working in a new Google solution called RCS, Retail Common Services, and really trying to build a platform where with 6 or 8 pieces of data from our client, both inventory data, customer demand data, as well as associate scheduling and skills, we've built a platform where associates that had been relying on their shift leader, and whether it's a clipboard or just the gut feel of that leader to direct them to what to do next, we've now built an Android application that each individual can have that pushes, based off of algorithms and the data within RCS, their next best action, optimized for profitability. So day to day, they know that what they're working on, whether it's for the store opening the next day or for demand over the next 2 to 3 hours, what is in the store that needs to be brought out on the shelf? What is the next task that they need to do, whether it's cleanliness, recovery, or fulfilling a curbside delivery? And RCS is an out-of-the-box stitching of all of the best of Google platforms, whether it's Spanner, whether it's BigQuery, whether it's their open source OR solvers. It's really accelerated the work. So we've been able to take what had traditionally been an 8 to 9 month project, squeeze it in 3 to 4 months to quickly get to proof of concept and proof of value, to understand how can we really unlock what that associate's working on, and then learn and iterate as we start to scale across their chain. So just a really, really great partnership we've been able to have with Google to push this forward and see value quickly.
It's great to understand how data, analytics, and AI is shaping the future of healthcare and retail industries. And I wanted to take a moment to thank both of you, Divya and Kevin, for your perspectives on the trends shaping these industries. And for our listeners, if you have any questions or are looking for more information on these topics, please feel free to reach out to any one of us. Thank you.